Yes.
Hello, everybody. I am Dr. Dan Cordelicchio, and I am your co-host for the Suburban Wellness Group podcast. I'd like to welcome everybody. We have the best of the best of the best, always talking about health and fitness on our program. And I have here with me my partner, my co-host, Dr. Natasha Fuksina. Hello, Dr. Natasha.
Hello.
And our guest is the best of the best of the best. She is Dr. Uma Naidoo. Dr. Uma, welcome to our program.
Hi, Dan. Hi, Natasha. Thank you.
Hello.
So let's go over a bio. I find Dr. Uma's bio fascinating. She is a Michelin-starred chef that David Bouley described as the world's first triple threat in food and medicine. Harvard-trained psychiatrist, professional chef, graduating with her culinary school's most coveted award, and a nutrition specialist. Her niche is nutritional psychology. I love that. In her role as a clinical scientist, Dr. Uma founded and directs the first hospital-based clinical service in nutritional psychiatry in America. She is the director of nutritional and lifestyle psychiatry at Massachusetts General Hospital and director of nutritional psychiatry at the Massachusetts General Hospital Academy while serving on the faculty at Harvard Medical School. She's been asked by the American Psychiatric Association to write the first academic text in nutritional psychology, and she has written a new book, upcoming. This is Your Brain on Food. It's going to be released August 4th, 2020. Dr. Uma, welcome to our podcast.
Thank you so much, Dr. Dan. I appreciate that kind introduction. I will just say that it's Chef David Bouley, who's the Michelin-starred chef that I collaborate with, and not myself.
I think you are the Michelin-star chef. How's that?
I wish I was, and I'll consider that an honor, so thank you.
That is a quadruple threat at that point. So, you were trained as a traditional psychiatrist, and you went to Harvard? Yes. So tell us about that.
It was an interesting journey. I think that I knew in medical school that I loved behavioral sciences and psychology and psychiatry. And so that was a natural fit for me. The program that I went to was in the Longwood medical area, fine institutions, and really privileged to work with so many wonderful physicians. And I think the experience, really the things that I think I remember the most is working very hard, but also understanding that I was learning more about medications and psychopharmacology, that I knew and understood that there were these emerging side effects about the medications I was prescribing and being taught to prescribe. And I felt a certain responsibility, especially because I love food so much, to sort of counsel my patients if I was going to prescribe something. And I think I remember that the most about residency, because I recall just becoming so interested in nutrition, despite the fact that, what we were doing was taking care of a lot of basic patients and trying to put those pieces together.
And so when did you change from that traditional model to going into a more clinical nutrition functional medicine model? So
I think there isn't a timeline as much as there is almost an organic way in which it happened. And by that, I mean, I was trained traditionally in psychiatry, and a good part of my practice is just traditional psychiatric consultation. My background is as a consultation liaison psychiatrist. That's what I did my fellowship in. And my work was in actually psychosocial oncology or cancer psychiatry, working at the Dana-Farber Cancer Institute in the psychosocial oncology department, which I think was an amazing experience. As I became more and more interested in food, and this actually starts way back with the fact that I grew up in a very large Indian family and everyone cooked, and so I didn't need to. There was always a grandmother, a mother, an aunt, and multiple older individuals and myself who were taking care of the kitchen. And so I learned to bake. And I learned to bake. My mom's a double-boarded physician herself, and she taught me to bake because she recognized that I loved science. And I am going somewhere with this. So when I got married, I actually didn't know how to cook. And, you know, I think my poor late mother-in-law thought I was going to feed my husband cake. But cooking became a journey for me. And it became a way that I learned getting family recipes. But it also became a point of almost a way that I could de-stress at the end of my day. So it really began to perform a function for me, whereas everyone else, not everyone else, but some people may go home and think, oh my God, what do I have to make for dinner? I would be quite happy at the end of the day to think creatively around that space. So I took myself to culinary school because I wanted to follow a passion and not because I necessarily had any great plan in mind. And that's what I mean by this developed organically. I had this strong you know, interest in nutrition and studied that because there was a gap at medical school, as you know. We were expected to talk to patients about so many things that are nutrition related and diseases that are linked, but we don't have the working knowledge. So that was the reason for me to fill in that gap. So I feel that I'd been doing this work all along in one way or another. But the elements came together for me when I had the opportunity under a mentor of mine who also has a strong interest in nutrition, and suggested that, you know, why don't I, if I wanted to see those, you know, wanted to offer this as a clinical service, I could found my own clinic. And that's how the nutritional and lifestyle psychiatry service started at Mass General. And so it became more niche in that way. But in honesty, as I was thinking about it, and as people have asked this question, I had been doing it for much longer than that, probably since residency.
So the Bouley Bakery, the burning question that I have, jokingly, of course,
yes.
The Bouley Bakery, so is this you behind it then?
Oh, no. So my, the interesting thing about my culinary career is I work as a chef instructor, a culinary instructor, and I, you know, I still function as primarily as a physician, and so I've not had I have the experience and have some training, but I haven't really gone and been part of a restaurant. My collaborations with Chef Bouley have been around nutrition and his really deep-seated interest and knowledge and actually global knowledge of nutrition in his travels. So we've collaborated in his Chef and the Doctor series that he hosts. So no, I wish I did, but an interesting thing about him, he actually was baking the most delicious gluten-free bread in all of his restaurants and other facilities for the longest time before it was popularized. And so it's that I think is fascinating. He decided to make that change a long time ago.
I've certainly enjoyed personally his creations more than once.
Yes.
Well, the next time everybody's enjoying, you have to invite me along because it sounds too good to be true.
Absolutely. Absolutely.
So I have a question. So did Mass General come to you? Did you go to Mass General to put together this department? Was it a collaboration?
So I've been on staff at Mass General. You know, I completed my residency at a different Harvard program, and then I was recruited into Mass General and have been there for some time. So I had different roles. I worked on the forensic and public psychiatry service. I did, you know, community outpatient clinics. And I think part of that was really for me about rounding out my interests in my career. I enjoyed all of those aspects, but as I did all of those things, I was still doing the stuff that I loved, like cooking, and decided to take myself to school and study more while I was doing all of that. So I was at Mass General, and I had a conversation with a mentor years back who said, you know, if you have this interest, there's a way that you should connect with Dr. So-and-so. And when I did, that's how it came about. So as part of our outpatient department, we're a part of that, and I do this clinical service as part of the outpatient department. So I was there already. I just had to find the right mentor who would support it.
So tell me about the clinical services. What do you provide?
You know, I see either patients who have psychiatrists prescribing for them already, and they come to me because they've developed a side effect of a medication that they're struggling with, and they may or may not want to taper off the medication because we don't do that without consultation and their doctors involved. But they may have a side effect like weight gain unexpectedly from a medication that you wouldn't have thought. And so we do a full assessment, and basically a full assessment nutritionally, a full assessment psychiatrically, a psychosocial assessment, the full gamut. If they need blood tests, we order those. But really we work in conjunction with whoever their primary care doctor is, their psychiatrist. And it's great when we can work as a team in the same hospital because communication is easier. Mm-hmm. I also get referred individuals who have significant medical illness, have taken, for example, this is just one example, a host of antibiotics because they've struggled with, say, respiratory infections, pre-COVID I'm referring to, and realize that they have a real dysbiosis. They have a real disruption of the gut microbiome. So they'd like to work with someone who can primarily talk to them about interventions they can try at home. Another group of individuals that seek out consultation with me are people who, the DSM-5-TR is a classification in which we use in psychiatry. There are, many issues with it because many people don't fall into an exact category of certain criteria. And as clinicians, I'm sure you all have seen that as well. So there are individuals who are able to function in their lifestyle, but they have, a low mood, or they're very, very anxious, they have poor sleep, or they have a symptom that is not preventing them from functioning, but they're really not functioning optimally. So I like to call that almost subsyndromal because they don't meet the syndrome of depression, but they still are suffering. And they might come to me, and I've had a good amount of success helping individuals like that tweak certain dietary interventions or make some lifestyle changes and help them to feel better. So that's those are just examples of some of the work we do.
So you mentioned gut dysbiosis. For our audience, how does that relate to a psychiatric condition? Because there's a lot of research going on right now when it comes to the gut dysbiosis, and there's a lot of research coming out of Harvard right now when it comes to the gut microbiome. So how does that relate?
So that's a great question. So you wouldn't necessarily think that the head and the gut are connected, right? Because they're not really close by in the body. But here's the thing, from embryological times in our body, so, from whence we are formed, and you think about biology and the how the zygote came together with the egg and the sperm. Well, all of that development happens, but when the vagus nerve forms, it forms from the morula, which is part of the embryological cell or cells. And as it develops, it grows between the brain and the gut. So it's connected from embryology. It's connected physiologically, which I'll explain in a second. It's connected anatomically, but it's also connected neurochemically. So as the vagus nerve directly connects the gut or the whole, of our small and large intestine to the brain, what it does is it serves a communication function between these regions. So you might eat something through your mouth and you taste it, it goes down into your stomach and your gut, and it gets, broken down and all of that. But the nervous system is involved. So chemicals get transported between the gut and the brain up and down. And what happens is that, therefore, in a very simplistic way to describe it, and it connects the gut and the brain, and therefore affects how we feel. So, the patient or the patients have come to me with significant dysbiosis due to need to survive an infection from taking an antibiotic or another agent. What happens when you take an antibiotic is that we have a large number of huge millions and trillions of bacteria in our gut. And some of them are good and doing good for our body, and some of them are not so good. And when what antibiotics do is they kill the infection, but they also kill the good bugs. and that's how the imbalance happens, which is called dysbiosis. So I like to tell my patients it's like a scale. When the bad bugs go up and the good bugs go down, that's when you get the dysbiosis, and that's when you start to have other problems. So that's probably the best way to explain what the mental health piece would be through the vagus nerve and that connection.
I find it fascinating, and it's something that I've been studying more and more as of late. And as a clinical nutritionist, functional medicine practitioner, I'm seeing more and more conditions that are psychiatrically related, and it's to the gut microbiome. You mentioned antibiotics as a causative factor. Is there any other causative factors besides antibiotics to create this gut dysbiosis?
Absolutely. So, coming back to the nutritional aspect, which I'm sure you could speak to even better than myself, I speak about the medication aspect, but what we eat directly affects that as well. So if we are eating processed and ultra processed foods, if we're eating foods that are very high in added sugars, if we're eating a diet that's high in the wrong types of fat, any of those things that are diet related can disrupt the gut. And part of that is that, for example, when we talk about a healthy, whole foods, high fiber diet, naturally fruits and vegetables, if you're eating them, nuts, seeds, healthy fats, the fruits, vegetables, nuts, and seeds all have natural fiber built into them. So when you talk about a diet which is rich in fiber, we're encouraging healthy eating in those ways. Well, fiber feeds the good bugs in the gut. It helps that balance in a good way. And if you think about that, realize that all the not so great foods that I mentioned affected in the opposite way. So an easy way to think about it is bad foods cause a bad gut, and a bad gut causes a bad mood. So that's just a simple way that I work with my patients around it to help them understand that it does actually matter what you eat, especially if you're not feeling good emotionally, because the tip of that balance can go very far, and then you really have to work hard to correct it. And you may not see it immediately, because often, someone who's feeling stressed, for example, reaches for a bag of potato chips, or they reach for a candy bar, and they feel, they feel happier. They feel great. I mean, watching a movie, and especially during COVID, I like to call it what my patients are, understanding maybe the COVID-19 pounds, because they're struggling, and it's hard to be in lockdown or have been in lockdown and not be able to exercise, not be able to be outdoors. And I saw an article recently that showed that processed foods are high in demand again, because that's, shelf stable. It lasted on when some of the shelves were more empty earlier on in COVID, and people are eating it more. But those are the things that just sway the balance in the wrong direction.
And
interestingly, if I could comment, when we are talking and discussing these psychiatric medications, specifically antipsychotics,
Mm-hmm.
which do contribute to weight gain significantly, that's been
Yes.
long established. And the medication that I, for example, use in my practice and has been used in practice by obesity specialists has been metformin, which has been shown to offset some of the weight gain effects
Mm-hmm.
of antipsychotics.
Mm-hmm.
And on the flip side, linking it back to the discussion of microbiome and gut health linked to the brain health, I would like to comment that metformin has been also shown to change microbiome in a positive way. So here you have a psychiatric condition which is treated with an antipsychotic,
Mm-hmm.
causing the weight gain, right? Weight gain may have, other than all the medical side effects that we know that come with obesity. We also know the negative psychological effect and self-image and other effects. We're giving them
Yeah.
metformin to improve insulin sensitivity, to offset some of the weight gain caused by the antipsychotics,
Got it.
and improving their gut health at the same time.
That's awesome. Yeah. I know that, and I think that's a great point. So thank you for reminding us of that.
And I find it interesting that our diet affects this, and we're talking about the processed foods. And Natasha and I, we read an article last year, at the end of last year, Mayo Clinic proceedings, and they were discussing the processed foods and the ultra processed foods. And the three factors that I found interesting with that is that they were readily available. They made them very palatable.
Yes.
And they were inexpensive. Those 3 points just stick out in my mind, so that, during COVID, I'm having a lot of patients now that want to come back, and they've gained that weight that they've lost, and those conditions such as diabetes, perhaps that's related to the gut. They're back now, and they've gained that 15 pounds. And they're telling me that they are reaching for these processed foods because it's so much easier. And you can feel bad because it's COVID, you're in quarantine, right? And you can feel good by eating this processed food, but then on the back end, it doesn't work out so well. It's not working out. Dr. Uma, I'm sorry.
No, that's exactly it. Because like I said, in the moment it feels good, and initially during COVID, I was, especially when shelves, certain parts of supermarkets were empty, there was always enough food, but there were certain things that, you just couldn't get. And it was a little scary for people, and people began to buy more food. And what was available was a lot of the processed shelf stable foods. Initially I would, and I still do believe in a balance. So I say to my patients, eat healthy, 6 days of the week, but have a fun day of the week. Depending on what you do, who is in your family, where people are. It could be a Wednesday, could also be a Saturday or a Sunday. It depends. So enjoy those foods that are treats for you, but have a day that you do that so it's contained, and you self-correct the rest of the week. That being said, I think that what's happened with the shelf-stable foods is that we've taken on these treats, and we've enjoyed them throughout COVID because it's been stressful. Unfortunately, though, over the longer term, they don't serve us. And I say that as being part of this, because it's been a long time, and the lockdown has been a challenge for many of my patients and many of my friends. So it's something I understand, but it has a long-term effect. And that's the concern that I have about the mental conditions involved.
And what I find interesting that you mentioned is that you're giving them some leeway during the week for a day to perhaps go off of a diet, and it's called flexible dieting. And I was not a proponent of it, but then I've started to add that into my practice, and patients appreciate it a little bit more, because it's not overwhelmingly, this massive change that happens right away. And there's caveats with that, because if somebody comes in and they're type 2 diabetic, they have cardiovascular disease, and their lipids are all over the place, I'm going to be a little bit more stringent when it comes to that. So you have to weigh that out clinically as to what you're going to do with that particular patient.
Exactly. And individuals who are more, who have more medical conditions who are seeing me, I always, make these decisions together with their primary care physician, just because, they're not, they may be on many other medications or on a path that someone else has recommended in terms of what they eat. But I find that there's a way to integrate those two. Dr. Dan, the other thing I wanted to mention, and Natasha, was that, when you said that about processed foods, I think the fact, what it reminded me of is making processed foods more palatable is actually billions of dollars of research and development. So something that many people don't realize, or maybe they do, is that fast food French fries have sugar in them. And that was added specifically because testing was done that showed it makes it more palatable. So who can, prevent themselves from not getting the larger size of the French fries, getting more of it. And then when you do get it, it's very hard to stop eating them. So all of that has actually been tested and been made that way for our eating pleasure. The problem is once in a while, okay, but the problem is that more consistently or eating that chronically is what leads to issues.
Yeah, so because I remember in high school, getting those French fries from a fast food restaurant was almost like a drug where you didn't stop eating them, and
stop.
They weren't supersizing back then. So you would go and you would purchase another 2 or 3 of those small bags. Now, back then we didn't know that it was made with the rancid oils, maybe corn oil, and the omega-6 fatty acids were very high when it comes to that. And this leads to further gut dysbiosis, but it tasted good. That's what we knew. It tasted good. So you had your hamburger, you had your sugary soda, and then you had your French fries.
And ketchup. Don't forget ketchup.
And ketchup.
Sugar.
With all the added sugars.
And you had all the added sugar. And now when you went back to school, when I was in high school, by 1:15, you got back around 1:45. The rest of the day was shot. You just weren't even thinking. You weren't even thinking straight on that. Now, Dr. Uma, tell me, what diets do you like for psychiatric conditions? What are a couple of few of the best diets that you would recommend?
So that's another great question, Dr. Dan. I tend to be very integrated in my approach, and I don't necessarily recommend a specific diet to my patients. I really use almost a personalized approach, and here's my reasoning behind that. I think that many of, say, the diet programs have a lot of great principles that they're teaching individuals, like mindfulness, or integrating. For example, there's a very, very popular app called Noom. My patients love it. It uses principles of CBT and other really psychological dynamics to help people with goal setting, accountability by having a coach, and that type of stuff. I think that they all do a great job. If someone is having success with a particular plan, I don't discourage them. But if they're coming to me for a consultation, I really try to make it a very personalized approach. So from point A of when they walk in the door, of getting the appropriate history and finding out what they're actually doing, making the tweaks, talking to them about the nutrition and the psychiatric balances of these, making sure they understand things like the gut microbiome and basically the impact of that, things about inflammation, not neuroxidative stress, all the foods that impact these, and then coming out at the end with also recipes and how they can implement the plan. And that's something that they appreciate, because you can walk them through, the patient who loved, lots of potato chips because that was her go-to food when she was stressed. She's learned how to make, oven roasted kale chips. She now has invested her money in an air fryer oven so that she can still have those treats in a much healthier way. So she's, how could I fault her for making zucchini fries? If she's doing that, she's adding vegetables to her diet and she's doing it in a healthy way. So it's, part of it is personalized for the individual. I think that there's a lot of good data about the intermittent fasting diets and, the food restricted timing diets. Mm-hmm. I think that it really, again, I happen to mention that because it's a hot topic right now and a lot of my patients are asking about it. I don't fault any particular diet plan, but I do find that my patients complain they're too restricted. If they give up a certain food, and I'm not talking here about high cholesterol or, a diet for specifically balanced for someone who's diabetic, but I'm speaking about more, give up a certain food group. And what happens is we understand psychologically how habit change happens, and they follow this along, and then suddenly one day they hit a wall because they can't keep up with it, and then there's a boomerang effect, and then they don't feel good, or they gain back weight, or they're not able to sustain their weight loss gains.
And I think I'd like to ask you specifically, now that we have 3+ months since COVID,
Mm-hmm.
and we have seen already patients come back for follow-ups, perhaps new patients with new complaints. Our experience here in New Jersey and in New York area with one of the largest hotspots has
Mm-hmm.
been anxiety. A lot
Mm-hmm.
of anxiety, an exacerbation of pre-existing psychological
Mm-hmm.
condition, but specifically anxiety.
Mm-hmm.
Is there anything specific that you recommend nutritionally for anxiety that we could mention maybe for the sake of our listeners today, specifically for COVID times, adapted to half lockdowns or maybe coming out stage by stage, specific for each state of the country?
Sure. So I'm going to suggest I wrote a blog for Harvard Health Publications, which is available online. And in this blog, it was updated last summer. In this blog, we break down the different foods and food groups that they should eat. So we go beyond, healthy kind of, healthy fruits and vegetables that you should be eating, and the healthy fats. We go into walnuts and specific prebiotics and probiotic foods. And I think that would be super helpful. I think that, that would be good guidance for them to start incorporating those foods, because I think that what's also happened, Dr. Natasha, is that anxiety, like you well point out, it's exacerbated, but it also might have not existed in some people.
Yes.
And they're now finding themselves very anxious. So they have to find out where they're at. And where they're at may be actually related to what we just spoke about, which is that their diet might have swung in a very poor direction. That's also impacting the level of anxiety, how they're eating and what they're eating. So to self-correct, incorporating healthy whole grains, prebiotic foods, probiotic foods, foods rich in zinc, foods rich in magnesium. And the reason I refer them to the blog is because I think it's broken down for them there.
Very nice. Thank you very much for your point.
No problem.
And here's another point that I think is extremely important, and you want to use the term game changer, is that you're giving your patients recipes. And I do that also, because they may not know how to cook. They may not know how to approach this. And it's a daunting task. And it goes back to what you were saying before. During training, nutrition was minimal. You had maybe a course, a couple of credits, when we were in school, and you can say, oh, just eat right, or just eat more vegetables. And then the patient walks out and they don't know what's going on. But I think a game changer is recipes. I give my patients recipes. We have to collaborate and see which recipes we're doing. And this is where I understand that you're this triple threat: psychiatrist, chef, professional chef, nutrition specialist, right? I understand that. And this is what makes you, where you are with this. Now, tell me, what type of psychiatric conditions do you find respond the best to diet?
So it's interesting. I think that's a difficult question from the perspective that the highest number of patients I see have either depression or anxiety. There are patients I see with the other disorders, but the largest number are there. So that would be a skewed response, right? Because of those numbers. I think that we probably have the most working knowledge of treatment responses and foods with mood disorders. And I think that and I think COVID is helpful because it's teaching us more about anxiety, what I'm actually calling COVID anxiety at the moment. And I think that it's actually very real. It's something that we're going to be seeing more of. I mentioned Zoloft, sertraline, a potential shortage, and that's not to make people anxious. It's just to indicate that, there are ways to get medications, but it speaks to people just feeling out of sorts right now. And anxiety seems to be, with the uncertainty, with the confinement, which is essentially what lockdown has been, the decreased amount of exercise. Exercise impacts mood. We know this. It affects multiple things, but it also, as a psychiatrist, it definitely impacts mood. So all of these things, I are really leading to the higher levels. So I can't pick out one disorder, but I will say that I see the largest number of individuals with depression, anxiety, and that mood disorders tend to respond very well.
Right, right. I find that also. I also see a fair amount of patients with ADHD that respond well with clinical nutrition. Now, you've written a book.
Do you mind if I ask you on that, Dr. Dan, what in your practice responds well in ADHD?
So what happens is when I have a patient coming in, I'm always looking at the gut. Natasha and I, we always discuss this. We're always looking at the gut. We're always looking at food intolerances. So we'll do a food intolerance test because, again, you want to use the word game changer. Tell me what you should be eating versus what you should be avoiding. And what I found, and what we have found, is those with ADHD, they do have this gut dysbiosis. So treating them with a glutamine is very powerful. A product with glutamine, treating them with a prebiotic, a postbiotic, is also very, very powerful, and the different strains. So once we're able to regulate that gut, we can see that the behavior of the children are, I don't know if I want to use the word regulated, but they don't have that impulsivity when they're in class or they're at home. And I can tell you from personal experience with my son, who has been diagnosed with ADHD, and, going into school and eating in the cafeteria and, just putting $100 on the credit card, and they're eating and you're not looking at it. And here I am, the clinical nutritionist, but I thought I educated him, but he's eating bagels for breakfast, not only one, but two. A lot of gluten, a lot of gliadin now that you have in there. So his gut was inflamed. The foods he were eating was inflamed. So we find that impulsivity and those signs and symptoms are,
awesome. Yeah.
So
and to
that's
comment on that, I could just add quickly to this. B deficiencies, vitamin B of all sorts, the whole B complex, not just the B12, very common. People who are addicted to fast foods and sugar-laden foods do not eat enough green leafy vegetables.
Yes.
So since I would have the ability of laboratory testing in the office, so it's common for me to run blood work. Could be just simple, doesn't have to be very advanced, to find B vitamin deficiencies, and they're much more common than I would have expected. So advising them nutritionally to incorporate those green leafy vegetables, meats, eggs, milk, provided there are no allergies or no food sensitivities, has been very helpful, because then they replenish the B vitamins, the folate, B12, B6, riboflavin, very important.
And without a healthy gut, I'm sorry, go ahead, Dr. Uma.
I know that with vitamin B12, with vegetarians or vegans, sometimes they actually need IM supplementation, intramuscular, and because as much as we give them food recommendations, it's not enough. And I agree. I think that the other thing I would say about anxiety is that when you asked questions about that, magnesium deficiency is linked with anxiety, and I think testing for that, if needed, is worthwhile. But if it's very easy to replenish, by giving people a food list or suggesting. I tend to stay away from supplements unless they're necessary, but it's a harmless supplement to suggest, and you can always go by a specific dosage, and again, it's individualized. I work in a very personalized way with my patients. It would be specific for that patient, but that often correcting magnesium will help anxiety. So it's another thing I think we should be paying attention to during COVID.
Let's buy Brazilian nuts.
They must be organic, though.
Exactly. So, and you got to tell people portion sizes with nuts, right? Because we love them, and then before we know it, we've hit the calorie count. So
Right, and that whole box of Brazilian nuts are gone now. They're
Exactly.
eaten, and that caloric intake is not so
It's
good.
up, right?
So when you say personalized, do you run a lot of lab tests? Do you run a vitamin and mineral panel? Do you run that food sensitivity test?
It all depends on the patient. Sometimes
Right.
I do, and sometimes it's not necessary. And remember, I'm still a hospital-based practice,
Mm-hmm.
so it also depends on what we can get covered. So I try to be
Absolutely.
conservative in that way, depending on what someone needs.
Sure. Now you've written this book. This is Your Brain on Food. I love that title. What was the motivating factor? Why did you decide to write the book?
It's so many different things, but I think most pointedly, I was invited to write several. Well, I think the best way to say it is that it was a way to bring my message forward. You were kind enough, both of you, to invite me to this podcast. It had been a body of work that I was doing. I have felt strongly that, mental health is often ignored. We speak about our physical health and why we should eat better for metabolic diseases, obesity, hypertension, diabetes, but the brain is omitted from that. And the mere discussion that we had earlier on, the gut and the brain are connected. We can't leave the head or the brain out of everything else that we do. And as a psychiatrist, I felt that strongly for a long time. And I think that through the way my career has developed, that food has become a very important point where I can make an impact. And I felt that in my book, where I basically looked at 800 of the most written about articles on different foods that impact different psychiatric disorders, and then I whittled it down to just over 560, and then took the message and tried to make it digestible in terms of how you read about it, so that it's not fact laden like you're reading a journal article, but try to make it doable for people. So we have simple food lists at the end of the different diagnoses, things to embrace and things to avoid, and then we have some recipes at the end. But I also, being a chef, had to suggest to people, this is how you'd set up your kitchen. These are the things you need. These
I
are
love
the
that.
issues around food safety, because I said to my editor, I really would love to write about that. And she was amazing. And she said, sure, I think that could be helpful. But so we offered a few recipes for each chapter, just so you can kind of have a menu that you can break down for each chapter and figure it out that way. But, I guess what I'm trying to say is that it was a way to bring my message forward, and I think that's what I hope it will do, and I hope it'll help people. That's the most important thing. The more people that can feel better through this mechanism, the happier I will be. So,
Right.
I can't wait. I can't wait to add a few more recipes to my kitchen.
We're looking forward. We're looking forward to the book, and I'm looking at the time. We're actually at an hour right now. And I think we could probably go on for another 5 hours.
Absolutely. It's wonderful to talk to you both. It really
so
was an
what we
amazing
want to do, Dr. Uma, is invite you back on.
Thank you.
We want to invite you back on, and we want to read your book. This is a great spot now to segue into our next podcast with you and discuss your book at length. Now, how can people get in contact with you? How can they purchase the book? I know it's coming out August 4th.
Thank you. So I have only the initial copy here, but more books will be available. That's what it looks like. It's available at all the major booksellers, but the way to get in touch with sort of my website is book.umanaidoomd.com. You will see the trailer, which describes the book there, but would also give you all the links to, firstly, subscribe to our website if you wish to get more information from us. We'd love to have you as a guest on our website. And if not, if you want to purchase, just go straight to Amazon or any of the links. I happen to mention Amazon because many people are familiar with that, but it's available at all the major booksellers. And thank you.
And all of our listeners, please purchase this book because, as you can see, Dr. Uma is a wealth of information. She has a passion for this topic, and you will be able to learn a lot by reading this book. So we're looking forward to it.
Thank you.
I want to thank everybody for being here
Thanks so
today.
much.
Dr. Uma, thank you. Dr. Natasha, I'll see you probably tomorrow. And I want to thank everybody listening in. Again, we bring the best of the best of the best, and Dr. Uma is the best of the best of the best. Thank you very much for listening.
Thanks so
Thank you
much,
very
Dr.
much.
Dan. Thank you, Dr. Natasha. It's lovely to talk to you both. Take